Hey everyone, welcome to another episode of Let's Talk About Sickle Cell, the Sickle Cell podcast straight out of the UK, raising awareness for sickle cell and discussing the ongoing issues that we have to deal with every single day. I'm your host, Jenica Leah, and I'm here with my Hot Topics co-host all the way from Miami, Florida, nurse practitioner Maya Bloomberg. Hey Maya.
Hey guys.
How are you? Happy holidays.
Same to you. I hope you had a nice holiday with your family.
Yes, I definitely did. It was lovely. Spent it in Jamaica. So it was warm, which is always a plus for, me and my sickle cell. How was yours?
It was nice, filled with family, making gingerbread houses and cookies and lots of child entertainment, but can't complain.
Cute. Okay, so let's get into our hot topic for today, which is pregnancy. Now, for the record, I have not yet experienced the blessing of having a child, but I still get asked by a lot of people living with sickle cell if I can have children. Like, it's a weird stigma for some reason that people think because I have sickle cell, I can't have children. And I think there's a lot of questions around that. I also get a lot of questions from the community. I've had people come to me to say, do you know anyone that's had a child? Can I speak to them? Can you put me in touch with them? And once I made this pregnancy group to help someone who was having a baby. So I think for those of us that have had a child, there's so much to share and there's so much to unpack. And for those of us that I guess haven't had a child yet, it would be really amazing to kind of be able to just kind of get some questions and answers to some of the things that are probably running crazy in our minds and that we want to know. So to start with, let's just start with the question that I always get asked, which is, can I even have children because I live with sickle cell? So as an expert, please can you let the listeners know, is this a possibility?
Yes, 100%. It is possible to have children with sickle cell. And I don't know who is spreading this rumor. Now, it is a more potentially complicated pregnancy, and there's a lot more coordination and consideration to go into a pregnancy, but that does not mean that you cannot have a child. I still remember one time I had a patient on hydroxyurea, and I said, you can't get pregnant on hydroxyurea because we know that this medicine can cause birth defects, and it's important that patients know to wear condoms and take into account contraceptives when on this therapy. So then fast forward, she ends up getting pregnant. She's like, I thought you said I can't get pregnant. And I'm like, I know, you're not supposed to. It's not the best. But that's when I realized we need to be mindful and with our words and just make sure patients actually understand what we're saying. Because in my mind, that was a clear communication. But in her mind, she's like, oh, I have sickle cell. I can't get pregnant. So this misconception definitely is out there, but 100% you can have kids, but it just requires coordination because it is considered a high-risk pregnancy, especially if you are older as well.
Okay. And when you say I know for a healthy woman who is going through pregnancy, it can be high risk when you get to a certain age. Is that age different for people that live with sickle cell? So I'm currently 34. I think, am I already in the high risk area considering I have sickle cell, or what would that be?
So advanced maternal age for anybody, regardless of a diagnosis, I don't want to say it because it's really depressing as I'm approaching, but it's 35 years old. They call it a geriatric pregnancy, which is just so insulting and probably named by a man, but I digress.
It's such a horrible name as well.
It is. I'm like, who the hell picked that one out? Come on. So advanced maternal age for 35 and up for everybody, but with sickle cell, especially if you have hemoglobin SS or S beta thal 0, where it is a little bit more severe, you probably are automatically going to be high risk regardless of your age.
For the listeners, I'm going to use myself as kind of like the muse with these questions. And so I don't want anyone to feel like I'm talking about them. I'm talking about me. I have SS. I've had loads of complications. For those of you that didn't listen to our last Hot Topics episode, you can revisit the list. With you saying that, we're already high risk, will that determine the difference between how I would give birth? So C-section versus natural birth. Are there pros and cons? How does that part work?
Yeah. So let's talk about just some of the complications we can see with sickle cell. So when it comes to getting pregnant, we can see higher risk for miscarriages, which again, for the general public, around 1 in 3 women can have an early miscarriage and that be completely normal. And unfortunately, I am in that statistic as well. That being said, I have my most beautiful rainbow baby, and I think there's silver lining to everything. But sickle cell can increase that as well. So if you have 3 or more miscarriages, that's something you want to get looked into before we just say it's sickle cell, because there could be some some management strategies that go into that. But when it comes to the sickle cell complications and what will determine if we're going to offer or recommend a C-section versus natural birth, so we know that pregnancy is a stress on the body and it has the potential to cause pain crises and other complications. That being said, I have some women who have month crises all the time, then they get pregnant and have the most uneventful pregnancy, which is just amazing and a godsend when that happens. And then it's the opposite, where there's some people who never got sick at all and now all of a sudden are having a lot of complications. So for individuals who do have a lot of sickle cell complications or pain episodes, that sometimes is a reason to deliver early. We do see preterm labor because of either an intrauterine growth restriction or a low birth weight. Because say you have reduced blood flow through the placenta because of sickle cell, that can lead to smaller sized babies. So if your baby isn't growing or is below a certain threshold, sometimes they do recommend preterm labor, delivering the baby early, which would then be by cesarean. There are a lot of benefits to, and I don't even say natural birth, I'll just say a vaginal birth, because the term natural, it's like you can have an epidural, but do you consider an epidural still natural? But regardless, but vaginal birth, there are a lot of health benefits, because when the baby is being pushed out of the vaginal canal, it's kind of pushing out all of the fluid from the baby's lungs. And from a health standpoint, there are benefits. And just from a recovery standpoint for a mom, you're not recovering from a surgery. But C-section a lot of times can happen again, since we do see preterm labor happening more frequently, or if you're having a lot of sickle cell pain crises that we can't get ahead of, or if your baby is measuring very small, they might recommend doing a C-section to just improve the potential outcome for both mom and baby.
Okay. So vaginal birth would be the ideal, just in terms of a recovery perspective and health perspective for the baby as well. So that's the aim. I know that you mentioned earlier, being on hydroxy, it's a very effective medication. And I know for a lot of sickle cell warriors probably take this, but of course you have to stop taking it once you are pregnant. Not that you can't have a child, but you shouldn't conceive whilst you are taking hydroxy. Would there be an alternative then for someone who is on hydroxy? They're now going to, start having a family and have children. If the hydroxy is definitely helping them, would there be an alternative like blood transfusions, or what would there be in place of that?
So almost all treatments for sickle cell cannot be taken during pregnancy. So not all pregnancies are planned. So if you are actively trying to conceive, then we'll have a patient stop taking hydroxyurea in advance. But not everybody plans it. So otherwise, you just want to stop hydroxyurea as soon as you become pregnant. And just to highlight really quickly, the other medications you should not take just because they can negatively impact the baby. From a sickle cell standpoint, that includes voxelotor, crizolizumab can't be taken. You want to stop any of your iron chelators like Jade or X-Jade. A big one for anybody is you should not take NSAIDs like ibuprofen, Aleve, Motrin during pregnancy, especially early, because that can lead to miscarriages. So if you have a patient who is having a lot of pain crises or a lot of issues surrounding pregnancy and they're not on hydroxyurea, sometimes we will put them on a simple transfusion regimen. I have some patients who are on regular red cell exchanges maintained throughout their pregnancy as well. Like most recently, I had a girl who she stopped her hydroxyurea when she was pregnant, and I was having to transfuse her probably every 6 to 8 weeks because she was having a pain crisis and feeling terrible. And it happened like 3 times. I'm like, you know what, why don't we get ahead of it and just get you scheduled every 4 to 5 weeks for your transfusions? And that's how we managed her during pregnancy. There are people who I spoke to just through my Instagram page, because I'm a big advocate for hydroxyurea, and there's different anecdotal stories of people taking hydroxyurea throughout their entire pregnancy and having a completely healthy baby. There was one person who I remember commented whose child ended up having different complications because she was taking hydroxyurea, and luckily through surgeries and whatnot is fine. So we do try to prevent it, but I know there are some instances where a provider might recommend hydroxyurea. I personally haven't managed anyone's pregnancy with hydroxyurea. We usually try to optimize with blood transfusions, and we can get you in for outpatient hydration. And pain medication, narcotics, 100% can be taken during pregnancy. I know when I have my patients admitted to the labor floor or just the OB units, they'll say, oh my God, you can't take narcotics because it's going to negatively affect the baby. But it's important to realize that the stress of pain on the body can reduce the blood flow and have more detrimental impact on the baby than just delivering a child who might have opioid withdrawal for a couple of days as they're weaned out in the ICU or hospitals.
So for anyone, and I definitely feel like we're going to have to do like hot topics on hydroxy, because we've already mentioned it so much, and I feel like there's going to be so many questions around that. My next question was going to be, if you are having a crisis during pregnancy and you're on like a regular transfusion thing, which is helping you to kind of maintain, you can actually still take pain relief. You mentioned not taking like NSAID, so like ibuprofen and etc. What can be taken? Or if it's like myself, I tend to manage my pain at home quite a lot. I rarely go into hospital and have like IV morphine, but what should and shouldn't be taken at home then if we're managing pain?
Yeah, so over the counter, the only pain medication that's safe for pregnancy is Tylenol. So avoiding NSAIDs for the entire duration of pregnancy. Narcotics are okay. So if you take Tylenol with codeine, or you take oxycodone or Dilaudid or morphine, I mean, definitely you still can take those. I deal with back pain. So for me, I'm a minimalist when it comes to pain medication. Like if I'm taking my pain meds, it's because I'm like on the ground and can't walk. So I have 2 pregnancies. One of them was a twin pregnancy, which just totally killed my back. And I really relied on the topical agents. So lidocaine patches and everything I'm recommending. But the topical agents are great because it's not systemically absorbed, which means it's not being absorbed throughout your entire system. So you can do lidocaine patches, which you can keep on for 12 hours. Voltaren gel is like diclofenac, which is a type of NSAID, but it's a topical cream. So that can help with anti-inflammatory. I got the CBD cream that has anti-inflammatory properties mixed with menthol. I had a patient who just introduced me to capsaicin cream, and capsaicin is the part of the chili pepper that makes it really spicy. And they basically extracted that to create a pain relief type of cream. So I think the topical agents should be ones to help. And then just knowing that the growing fetus is going to put more strain on your midsection, which is going to cause back issues. I loved my belly bands, and I would say get one earlier than later because that's just going to help lift up the stomach and take off a lot of extra strain, which for somebody with sickle cell could be a matter of preventing a potential crisis from that increased strain.
I have 2 questions. If someone I've had a vascular necrosis, I've had a hip replacement, I've also had decompression. My recent MRIs are showing that everything's fine. I'm not in any pain. Would the pressure of having a child impact that in any way, impact my hips? And also if I am taking, some pain relief to ease the stress of my hips or my back or wherever the pain might be, will the baby absorb any of that pain medication, and would that impact the baby once the baby's born? Would they be kind of come out with an addiction? Or because these are all questions that I've heard people query.
Yeah. Let's start with the avascular necrosis one, and then we'll talk into having a baby taking narcotics during pregnancy. So with avascular necrosis, for anybody, pregnancy aside, I think physical therapy is so important because by doing physical therapy, you're really strengthening that whole supporting joint structure. So the muscles, the tendons, the ligaments, by increasing that strength, it's really protective towards that joint because getting pregnant is going to put a lot of stress and a lot of pressure on your body. And it definitely can potentially exacerbate the avascular necrosis. So you might go from no symptoms and all of a sudden you're gaining 50 pounds from pregnancy and your hip is never the same after that. So it's definitely possible. So for somebody who's listening to this and they have AVN, I would say right now, focus on hip stretching and strengthening type of exercises and knowing that your core and your hip are connected, focus on that. And this is where I love Pilates. So I have all of these herniated discs in my back from twin pregnancy, and my neurosurgeon, luckily I didn't need surgery, but he says Pilates and PT is going to be your regimen. So I did physical therapy for months. And then once I got stable, I went to Pilates because your spine is what's carrying your entire body weight. So if you don't have strong core muscles, it's not about getting a 6-pack. It's strengthening your chest, your back, your obliques, your core, all of that that's supporting your spine. Otherwise, when you're bending over and picking things up, you're using all of these accessory muscles that shouldn't work that hard. And then you get worse in back pain as a result. So everything you can do leading up to actually becoming pregnant is going to help you so much. So you want to feed your body the right things, but you also want to be a healthy weight. You want to strengthen your body. So if you're like me, I did everything I could just since I had miscarriage and I had all these fertility issues before I was able to get pregnant. I really tried to control whatever factors I did have control over. And that was pretty much just my lifestyle and diet and nutrition and physical activity. So I would focus on the core strengthening and hip strengthening, and Pilates or yoga is great for sickle cell because it's low impact. It focuses on deep breathing. And again, it's just setting yourself up to have a better possible outcome from a pregnancy standpoint because it is a lot of weight. I gained, 70 pounds when I was pregnant with my twins. So you can imagine if I had a bad hip on top of that, holy moly, that would be crazy. So, but knowing it can worsen it, I would just, if you do have AVN, especially of the hips, I would maintain a healthy weight, which you definitely look like you're doing that. So kudos to you. And it's important to really, my patients sometimes get offended when I talk about weight loss, but if you're complaining of back, hip, or knees issues, I can't not mention weight loss because it's extra stress. And a physical therapist once told me for every pound that you lose, that takes off 4 pounds from your body. So say you lose 5 pounds, that's almost 20 pounds of pressure being released from your hips and your lower extremities. And it just shows that that modest weight loss of like 3 to 5 pounds really can make a big impact. So slow and steady wins the race. Those crash diets aren't all what they're about, because once you lose the weight and get back to your regular routine, you're going to gain it all back.
Exactly. I'm glad you said that as well. And maybe we'll touch on AVN. But one thing I will say is that since having my surgeries, I've never stopped doing like the physio exercises. Like I'm always doing it every day, and yoga is something that I do as well. So good to know that I'll just continue that through my hypothetical pregnancy. So next question, will the pain relief that I take, will it affect the baby?
So currently there's no data to suggest any long-term risks for children or babies taking narcotics. We know that if a baby is receiving narcotics, or if mom is taking narcotics during the pregnancy, when they're delivered, they can present with opioid withdrawal. And that's just when the narcotics are leaving the system, because when you take your pain medication, it's not like it's in your system indefinitely. You're going to metabolize it through your kidneys and pee it out and get it out of your system that way. So the same applies for the baby. So we can see a child's withdrawing, and when they're withdrawing, they can be shaky. They might be a little agitated. They might have runny nose, tearing eyes. Sometimes I explain like the withdrawal symptoms is kind of like a really, really bad flu, and you can get pain too. So just completely off topic. Sometimes I always wonder with sickle cell, there is totally a physical dependence to narcotics. Because I mean, you have a chronic condition that causes severe pain. You need your narcotics. Very, very, very different than a psychological dependence where you're misusing your medication. But then sometimes when you are withdrawing from your medicine, you can get pain. So it's like you feel sick, you feel bad, so you take more narcotics. So it's like, are you treating withdrawal symptoms, or are you treating pain? So just something to keep in the back of your minds when you are taking your pain medications. Is it sickle cell pain, or does it feel different from that standpoint? But the babies will withdraw for 24, 48, up to 72 hours. And once it is cleared from their system, it's kind of smooth.
Okay, so my baby's healthy. Now, one thing that I should have, discussed before even getting pregnant, my hypothetical pregnancy, is the probabilities of someone like myself with full-blown sickle cell having a child with someone else. So it's important, of course, for people to know their genotype. Do they have the trait? Do they have any other kind of, hemoglobin disorders that could link with my SS? So what are kind of like the probabilities for someone who, let's say, just doesn't have any form of sickle cell or red blood cell disorders at all, so AA, and for someone who potentially has the trait, what would that mean for me? Or what would be the best thing for me to do?
Sure. So for you only have hemoglobin S. You have 2 hemoglobin S genes, which mean every child that you have is going to get a hemoglobin S. So if you have a child with a partner who has normal hemoglobin AA, all of your kids will have trait, which for most, it's a very benign condition, shouldn't cause any issues, and just very important to know when they have kids, they have that possibility of passing it on. But there's some things that I don't want to minimize, because there are some patients with sickle cell trait who do experience sickle cell-like complications, but for the majority, it is going to be benign. Now, say you had a partner who had sickle cell trait and you have hemoglobin SS, it's going to really just be a 50-50 chance of having children with hemoglobin SS versus having a 50-50 chance of having a child with sickle cell trait. Now, we're only focusing on hemoglobin S. You did mention it, but it's very, very important that you screen for any other hemoglobinopathy. So we know that sickle cell trait can combine with beta thalassemia trait. And if you have a sickle cell screen, that's not going to pick up beta thalassemia trait. That's not going to pick up hemoglobin AC. So it's really important to do a hemoglobin electrophoresis, which is going to give a breakdown of all the hemoglobin you produce, and also do a CBC or a complete blood count, because that's going to clue in a suspicion potentially for somebody with thalassemia trait. Because if your partner ever said, oh yeah, I had iron deficiency once, that would be a red flag. Like maybe they actually did have iron deficiency, but beta thalassemia can also look like iron deficiency if a provider doesn't know how to be thorough and look for it. So it's an important discussion to have with your partner, and just for somebody to self-reflect even before you have your partner and think, would I be okay with having a child with sickle cell? And again, our last hot topic was on gene editing. So this is just the start of having the potential cure for patients, where we are going to have so many different treatment options to improve the outcome and the quality of life. So it's going to probably change a lot of the dialogues, because maybe people who might not didn't want to have a child with sickle cell and wanted to prevent that. So that means that they didn't have any partners who had sickle cell trait. maybe would start to consider if there was a therapy that was actually accessible that could prevent a child from having all the complications they had to deal with. But yeah, it's important to know that all your kids will have sickle cell trait, and just start to consider, are you okay with the possibility of having a child with sickle cell or not? Because if the answer is no, and you want zero chance of having a child affected with sickle cell, it's important to either screen your partners or to determine what the other options could be to avoid that, such as like IVF or even surrogacy.
And a question, I mean, I'm not sure if you would know the answer to this, but is there because I know obviously we're talking about gene editing and all those stuff. Is there a way, like during pregnancy, or say I was going to go down the IVF route, if I did have a partner who had AS, or even let's say someone else who had SS, is there a way to get rid of that gene and then, I can suddenly have a child that doesn't have even the trait, or will they always have to get like one of my S genes?
Currently, they would have to have your S gene. And it's a good point to make, because with gene editing therapy, you're still going to be able to pass sickle cell to your children, because it's not affecting our eggs or our germ cells with the sperm. So you can still pass it on to children. So it's not curative from that standpoint. So even if you yourself get cured, you're still going to be passing that hemoglobin S gene to the child. There is something called IVF with pre-genetic determination, PGT, where they can actually look at the embryos before implanting them in the uterus, so they can screen and see, does this child have sickle cell? So this could be somebody, I mean, even if you were fine with the sickle cell trait but didn't want sickle cell disease, they would be able to identify the embryos that have just sickle cell trait. Which I think is really exciting, but it's interesting having conversations with other people, because some have concern over the ethical aspect of it and kind of view it as eugenics, which I do understand and can empathize, where in my outlook, I'm like, hey, if you have the opportunity to potentially decrease your risk of passing on sickle cell, knowing what that can cause, why not take advantage? But I do understand why people would feel potentially negative towards it, which I think is just even more education and just making sure we preface the conversations in a way that we're not saying that this needs to be done. It's just an option, but it's not approved by insurance and it's super expensive. It's tens of thousands of dollars. IVF isn't covered by most insurances either. So there are ways when you're actually pregnant to see, do you have a child with sickle cell disease? There's an amniocentesis, which I think can be done at like 10 to 13 weeks. And a little bit before that, there's a CVS or chronovillus sampling where you can test the actual fluids to see, does your child have sickle cell? But it's important to realize that those are invasive procedures and could potentially increase your risk of miscarriage. So if having a child with sickle cell is going to make or break whether or not you keep the pregnancy, then it makes sense to consider getting it. But if you're going to keep the child regardless, if they have sickle cell or not, then it might not necessarily be worth taking the risks of an invasive procedure.
Right. So down to the individual in that case. Okay. Well, I feel like I am a little bit more confident when it comes to the potential of my hypothetical pregnancy and having a child. One of the questions I always get asked is about the pain of, childbirth. Can it trigger a crisis because of the pain? Is it more painful? I did a poll on our Instagram page asking our mummies what pain was worst. Was it childbirth, or was it sickle cell crisis, or was it the same? And none of you said that a crisis was the same. 53% of all of the women that entered the poll said that the crisis was actually worse than childbirth. And the other 47% said it was about the same. So for me, I mean, it's a little bit settling to know that, okay, if I've managed to go through however many crises I have in my whole lifetime, I'm sure I can manage the pain of childbirth. But do you know anything different, or would you have anything to, say to any like future planning mummies with sickle cell?
I could just speak to myself and what my childbirthing experience was like. Honestly, it's very interesting seeing these polls. And I think it ultimately boils down to a person's pain tolerance and their pain thresholds, because I was in labor. I remember I was food shopping and I'm like, wow, this food shopping trip's a little hard. I'm like hunched over. And it's like, it didn't even occur to me that I'm like clearly having contractions. Like I was just carrying on with my day. So I think people have a different pain threshold and tolerance towards it, but we manage it and we do what we can. It's kind of difficult to say. I heard that kidney stones are apparently terrible too, but I think we should poll our questions. I'm more interested to see, because I hear from a lot of people that their pain is much worse after delivery. We should do a poll and see, is your sickle cell pain the same, better, or worse after delivery? Because I hear a lot of women saying that they went from no pain to more pain. And I wonder if it's the stress of just having children, negatively impacting, or if we see any common trends, or if it was a coincidence that I feel like many people are saying that one, unfortunately.
That's interesting. And as you said in the beginning, I know I have a friend who was really kind of unwell and always having crisis. And as soon as she fell pregnant, for her whole pregnancy, she didn't have any crises. She was absolutely fine and healthy.
And those are the best cases. And honestly, it is possible. It's totally possible. I would say I have fewer patients who are getting so sick during pregnancy where I feel like I'm constantly having to arrange outpatient fluids or blood transfusions or coordination from that standpoint. I think the majority of patients, you've dealt with sickle cell the majority of your life. If you have a sickle cell crisis when you're pregnant, it's going to be kind of similar type of management. It's not to minimize it, but I think for most who have dealt with sickle cell, having a crisis. And it sounds terrible. Like when I'm saying this, it sounds like I'm almost like gaslighting, like, oh, you've dealt with crisis, which is like totally not my intention at all. I mean, these crises are super severe and they're debilitating, and you can be fine 1 second and hunched over the next, not able to move, which is awful. But we call you warriors because of your resilience. And every single time after time, you prove and come back. And I think we can have that same mentality and mindset during your pregnancy that you've survived all of your crises this far. I'm going to survive this one too. And just keep the mindset positive throughout pregnancy and not focus about the possibility of having sickle cell crises, because that anticipatory anxiety of the what ifs, that stress alone can trigger sickle cell crises. So mindset is, it's really, when it comes to chronic illness and sickle cell, 100% is a mindset game. I think I read a quote once that said, it was basically saying suffering is optional. How did it start? Like pain, everyone's going to experience pain, but the suffering is optional. And it just shows that if you can kind of control your thoughts and realize, like, think of affirmations that really help you get through the tough times. And we say a miracle is when you're having a shift of your mindset from fear-based thinking to one of love. And just that subtle shift in your mindset really can change the trajectory of that sickle cell crisis. So when you're having one, I would say first, just it's possible you might get a crisis, you might not get a crisis. So that anticipation, you just have to focus on what you can control. Otherwise, that negative stress can negatively impact. And then when you are having a sickle cell crisis, I would just try to write down, even on your phone, like, what are affirmations that can help me have that subtle shift in your thinking to help you kind of get over it a little faster. And then everybody, if you're pregnant, should get connected to a good hematologist and a high-risk OB. That way we can just have the seamless process of coordinating. And we know that there are different complications that we can see at higher rates for sickle cell. So we'll be able to detect and pick up on those signs and know if you're complaining about certain things, what to kind of like clue in or clue out a suspicion for a potential issue. So definitely get connected to high-risk OB so we can just have the best possible outcomes. But pregnancy is possible. You can have a healthy pregnancy. You can have a healthy baby. And just, I think the mindset is the biggest thing that you should focus on before, during, and after. And just as for all parts of life, I think it's all a mental game.
For sure. Well, thank you. I definitely feel more confident about my hypothetical pregnancy, which you never know. We could be having a podcast baby one day, guys.
I feel like we're manifesting your baby right now. We're going to next holiday.
I know, maybe. Next time, I'll be taking you all on the journey with me if that should happen. But no, this has been, even for myself, it's been definitely so insightful. I hope that for any of our listeners, this was a suggested topic that you guys voted for on our social media. So hope you found this interesting. Of course, keep in touch with us, stay connected. We are on TikTok and we are on Instagram at Sickle Cell Podcast. And Maya, can you share your platform as well? Because Maya shares some amazing tips and information and everything about sickle cell as well.
Thank you so much. You can follow me at the Heme, HEMENP, like nurse practitioner. My DMs are always open. Comments on any of my posts. My page is really just dedicated to providing reliable and easy to understand information so you guys can feel empowered to live your best life. So reach out, comment. I always answer all my comments and questions and would love to connect.
Great. See, so we're all dedicated. Right, listeners, until next time, thank you for joining us. Enjoy the rest of your holidays and take care.
Bye.